Hello everyone, this is the Shientist, and this is part two of introducing the Shientist and the Storm focus. This audio or podcast will be highlighting another intriguing and topical area around an entity referred to as research through social media platforms and best practice. In this audio, this is going to be an outline of different areas around research and evidencing uh, um, uh, understanding of those healthcare related social media platforms that look to bring together really patient and professional professional health professional efforts to ensure that there is a more integrated effort around research evidencing and best practice to bring those gaps in healthcare together in a more a profound and a more profound and more focused manner. This is a Ztorm Lobostics production, and we're going to break this down. I'm going to break this down into around three main areas. I'm going to give a brief introduction around this topic, an understanding around the literature, a kind of an educational stance on this topic, and then an overall summary. I will also, as done in the previous or the first the first Storm recording, there will be an understanding on how to identify literature for those of you out there who want to try and identify more areas of more examples in literature that have been evidenced, and hopefully they can the literature will help you to bring your particular um, uh, uh, efforts into the works that that you might be doing, and this is of course hopefully understanding and context for both patients out there and professionals, health professionals, and because ultimately the Shientist is all about making sure and really making sure that the evidence around different focuses around healthcare practices, where both professionals and patients could be working more integratively in smarter and perhaps more profound ways. It's important that both get a good grasp of how to approach and identify the literature out there. So to begin with, a brief on the introduction. So prior to 2005, communication had been and has been used, implemented in various ways. We're all used to, for example, using, telephone communication, and even communication through particular radio stations, or through writing, posting post-it notes, or posting message on message boards. There was lots of different ways prior to 2005, but electronic communication, and more so via online, through the internet, and online, and even online spaces. Electronic communication now, and identifying, and in this context relating to identifying healthcare resources, and informational support, has moved on, and perhaps in quite a bit of pace as well. There's now lots of cloud focused, for example, spaces, which actually help patients and professionals really to where they may make notes, may even do that by hand, putting a pen to paper and scanning their work, and then saving it either on their desktops or onto a cloud, so that they can access that at a time, at their own leisure, and actually even through different devices. For example, if not at someone's desktop, then maybe through a smartphone, or even through a remote device. Education, however, or where at least where healthcare education is concerned, and healthcare informational support is a basis that was primarily, also mainly available in brochures, books, leaflets, and exchange of email exchanges, perhaps not so much between professionals and patients, but perhaps between for example, patients exploring um, new ideas, or updating on existing ideas, and looking to involve their peers, and so forth. And the same applies to health professionals. Now, social media has also moved on. And more so, perhaps something a social media platform that everyone is quite familiar with, and that is Facebook, and it's become pretty much a mainstay, a mainstay form of communicating and sharing online. And it's become actually a household name, perhaps over the past I would say, I would initially say a couple of years, but obviously we're in 2021 now, so quite easily over a decade, or perhaps even 2 decades. So and in that regard, it's become a household name with users around the globe. There's people who are health professionals, there's patients, there's perhaps those who are well known in other industries, that also might be using Facebook. And there is literature out there to highlight how how patients and professionals, perhaps, and those in different industries, and generally how the public interact through social media platforms. And there are also other household names now, as well, and they include, for example, YouTube, Instagram, and even using telecommunications as well. For example, Skype, and there's other household names out there, and I'm sure those who have an opportunity to listen in on this would know that the landscape, or the social media landscape, has developed, and has gone from something simple in relating to Facebook, for example, and how that's been used, to more broader social media and networking sites. So social media and networking sites also facilitate maintaining a sort of virtual connections, so that interconnectivity really continues, or there's a continuum around that. And this means that with those sort of relationships, or those that foster positive communication, really, between those who are using them, then that can bring about potentially also more understanding around sort of areas in areas of healthcare. Um, um, and of course, that sort of interconnectivity can also prompt patients and professionals to actually develop um, uh, uh, develop on a personal level, but also on a professional level. Ultimately, the, the 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 way that people are now um, um, using or harnessing social media platforms, it really is uh, um, 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 an entity that or entities that people really are um, using more and more in different ways, and perhaps with more novelty, having been prompted to perhaps um, uh, work remotely, for example, uh, uh, having to work remotely um, uh, in most cases, as prompted by, for example, COVID-19 guidances of COVID-19 guidance, and those who have been affected and those who have been restricted as such. Um, so retrospectively, though, in the clinical setting and through traditional modalities, people have actually come together and also helped one another adjust in one way or another. And I give the example again around the long-term condition, chronic kidney disease, because I think it is actually quite a though it's a kind of a long-term condition that isn't really understood so much in the public domain, which is perhaps another reason why I will will potentially continue using that example, but add in other long-term condition groups. For example, uh, the focus around CKD, or chronic kidney disease, is not really are harnessed in the public domain. So where social media has its advantages, has been apart from the more recent COVID-19 and pandemic restrictions that have embarked on public life and generally in the public domain. The Those who have been befallen from going through long-term conditions, and again, CKD, or chronic kidney disease, being the one I want to focus on. People have helped adjust through that, through sharing understanding and experiences through, for example, again, I'll give you the example of the renal patient support group, or the RPSG, which is primarily which primarily has been a Facebook group since 2009. So in that in bringing this context together, people have helped each other remotely, through social media, at least through the RPSG, um, uh, um, over over a decade, and since 2009. So and that platform, or the social media platform, has been, as I understand it, really, a place to a place for, where there's an exchanging of information, informational support, emotional support in some way or another, instrumental focuses, where patients, and carers, for example, may find that there are challenges, different challenges around areas of their healthcare. They've found that approach through the RPSG has been instrumental in bringing their experiences together, so that they can actually make more informed decisions and choices around different aspects that surround their chronic kidney disease, and long-term condition. I want to highlight there's work by who and colleagues in 2013, and there was actually a couple of papers by Hugh and their team, in that year, and I will highlight that. I will highlight the full references towards the end of this podcast, but there are actually some basis of what sorts of social media platforms and online spaces really have been have worked quite positively for different long-term condition groups, and not just a chronic kidney disease. And I now want to give a bit of background on providing a kind of an educational stance on this topic. And that is to say that educational support, and by educational support, again, as mentioned briefly in the introduction, that can be approached in various different mannerisms. For example, again, brochures, books, leaflets, and even through email exchanges. For example, there's also a few other entities in which educational support can be harnessed, and that is by exchange of advice, explanations, research, opinions, and experiences, different experiences, and that these forms of educational support actually helps, or can help, patients looking for, or looking to approach certain areas of their own personal circumstances, can help patients it can help themselves, and obviously if there are those who are looking to get understanding on behalf of another patient, it could be also a carer, for example, looking to get more understanding for other carers, or a carer for other patients. For example, um, uh, these ways of educational support are pretty much uh, um, uh, household as well now, and the RPSG has a paper publication highlighting the efforts around the RPSG, or the Renal Patient Support Group, published in 2014, and also how it helps patients gain understanding, about how to sort of bring together different areas around their health, and how they can potentially address those in different ways. And to also highlight, apart from the work by Mohammed and team in 2014, there's also a very there's documented evidences around different forms of educational support, and understanding of how different patient cohorts might interact with that, and that might be and I would encourage listeners to see if they can identify these sources, these references, as well, as part of as part of some of your own follow-up reading, and that is works published in Involve, as in Involve publication in 2012. There's a publication by Hugh and Ackerman in 2012, and Hugh also published two other publications in 2012 as well. In contrast, in contrast, the way patients approach online spaces varies. So some patients, as I'm sure we're all familiar with in some way or another, that they may approach to gain support around best practices, and maybe updates in certain areas that are directly linked to their healthcare. Some are on online spaces to get an understanding of more broader lived experiences. Some are on there for are on these online spaces for getting an understanding of how to perhaps cope or manage aspects of their health, and some are on there for general interaction and interactivity, and also, of course, there are people and patients that are on there, and carers on these online spaces where they look for emotional support. But all of that being said, all these different forms these different forms of uh, um, uh, wherein patients uh, might look to approach online spaces or social media platforms, um, um, that also can um, uh, can can only be smarter if um, the patients themselves look to link what they are learning through these experiences by identifying um, 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 resources that can also be connected, and that is an important uh, uh, understanding to be had here, because um, uh, where there are social media platforms that are out there for patients, if they are not, for example, evidence-based support groups, then, for example, giving where patients and carers could be sharing experiences, that's very important. Of course, it does help alleviate initial um, uh, um, issues and concerns, and perhaps personal a patient's different personal circumstances. But unless patients are um, are not if they're not uh, interacting or connecting by accessing to-date literature around their health, then the issue is that these online spaces or social media platforms can be very very blasé. They are spaces that are there, but patients do find themselves um, uh, uh, do find themselves going round in circles, looking for more uh, uh, understanding to actually bring closure to a particular issue around their healthcare. So evidence-based support groups are now needed more than ever, because where there can be problems around health literacy, and language, or health language, um, uh, patients uh, will can thus find it more challenging following up aspects of their healthcare with a health professional they uh, uh, if there might be a health literacy or health language barrier. Obviously, every professional will work to do whatever they can to break down that language barrier, health literacy and language barrier, and health language barrier. Um, um, but they do all health professionals also have their time constraints. Now, with with this in mind, those health professional uh, health professionals um, should also be supporting patients access or identify literature and evidence-based publications around different different phenomena around aspects of the patient's healthcare, and listeners should understand, or should hopefully get the understanding, that by and large, the health professionals are and make it a premise or a foundation, and make it a stance of their own, that communication is pinnacle. It's what they base a good number of years of their training around, being able to communicate and doing that in different ways, with their colleagues, fellow health professionals, and of course patients. So they are also they have or should have that responsibility, and so coming back to social media platforms, if they're not evidence-based, then actually patients talking to other patients or communicating to other patients can become quite blasé, and though there might not be a direct issue with how patients take forward aspects of dialogue or communication that they have through those non-evidence-based social media platforms, then ultimately that's it's down to an individuality, the individuality of the patient, and how they want to move around aspects of their healthcare. But the growing issue or concern is that patients are spending almost inordinate a number of inordinate a number of minutes or hours or time generally in online spaces, and not identifying real responses in some way or another to actually approach a particular aspect around their healthcare. And that means they will find that there is no closure or limited closure around that. And then when going back to a health professional about a particular issue again, or that particular issue that was bothering them, or what's been troubling them around their healthcare, they might find themselves back at square one again, or back to the main underlying conundrum. So what I want to say here is also that that all being said, using social media platforms has advantages and disadvantages, but it can strengthen interaction and self-esteem, as well as reduce distress and anxiety concerns, bring more more empathy towards aspects of health, provide reassurance. Support can also um, uh, be limited, um, uh, where 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 patients help, apart from having may have their own limitations, addressing aspects of their healthcare. Um, Support where, at least from educational support perspectives, or where that's concerned, and where that might be limited. Um, there's also those areas of support that are actually discussed on and talked about quite frequently on these online spaces, or social media platforms, but unfortunately, this is where there are limitations, and that is to say that the support that might be required relating to the practical assistance, and practical assistance, for example, traveling to and from hospital for appointments, or to surgery, in primary care, or a family physician, or those places that need to be accessed, for these for appointments, in particular, as the main one, as one of the main focuses, that is where there are obvious limitations, because the online spaces and social media platforms, and as far as research highlights as well, that is where there are inordinate amounts of issues and concerns being discussed, but this is also where there are just ongoing concerns. And so, to that end as well, it might be things like travel insurance, where patients, for example, with chronic kidney disease, have inordinate of issues, and these are areas that are discussed quite frequently on these social media platform and spaces, in line with areas, for example, transportation, and help with, for example, household chores, for example, and accessing appropriate support in that way. That then brings me onto this topic, where I want to the area really around how social media does help integrate more and more so around joined up thinking, and perhaps a little bit of a focus around patient and public involvement in that context. And that is that, as I want to begin here by saying that social media um, um, and online spaces, whether there are forums within them, there are chat rooms, there are message boards, whether there are blogs within them, and through online spaces more generally, and of course, um, um, even going down to um, uh, for example, um, um, online spaces that offer um, um, patients and healthcare professionals to sort of task manage aspects of their day to day. Are now these sorts of approaches have been and are now opening ways in which patients and professionals between healthcare sectors can gain insights to focus and obviously communicate and again, I mentioned task or task manage. They offer that in one way or another as well, more generally. So the rapid growth in the acceptance of social media has unbolted really a channel for professionals and patients to interchange and gain perspectives on some of the most important aspects of long-term conditions like chronic kidney disease, and ascertain a more dynamic understanding of involvement in research. And there are papers by, again, by Hugh and team in 2013, and a paper by Prensack in 2014 highlights that in more broadly. So social media groups are becoming more or have been used and implemented and even joined up in aspects of patients' care to at least some to at least some aspects of consistency over the last a decade or even two, and they tend to be more of a first port of call of information or informational support, educational support. Um, uh, more is that these spaces have been made available so that patients patients and carers can bring together their lived experiences um, uh, and contribute to threads and discussions that appear on them on those social media groups or platforms. But that then also brings the focus around opportunities to link research and increase areas of the evidence around how patients and professionals really could be collaborating more dynamically as well. So whilst professionals could become part of these social media platforms and online spaces, they may not be as proactive, and this has been one of the one of the missions of the Renal Patient Support Group, or RPSG, since its conception in 2009, to actually have both patients and professionals working, learning and developing understanding between each other, so that healthcare practices can also be more widely, more broadly integrated, really, and patients, and also so that if there is more communication between patients and professionals through these online spaces, then that actually means that there's opportunity, really, for both to actively discuss and communicate on some of the most poignant subject entities, to prompt empowerment. So actually patients and health professionals take ownership across different entities surrounding healthcare. Thus, again, as briefly mentioned in the first podcast, that communication or dialogue can actually bring about more equity in some way or form, along with the patient's healthcare, but also bridge areas around to reduce healthcare disparities, and thus, with that, the RPSG, as I've come to learn or understand, has evidenced effort since the time of conception, and is where actually professionals can and should have confidence, really, that there is a kind of a pivotal example or principal example of best practice regarding science and research, at least as far as nephrology is concerned, or the study of kidney disease. And so research through social media platforms, and at least where one example of best practice is concerned, and linking in areas with regard to patient and public involvement, or PPI, the RPSG has sort of been a driver for that since 2009. So an overall summary, and then just a few of the references which I will read out, and listeners are more than welcome to follow them up. Although there is a developed guidance on the use of social media, and that and in and around research, and areas of patient and public involvement, and also things around, for example, clinical trials that patients may be recruited for as part of their own healthcare, involve in 2014 did have a conference about bridging those gaps, and also how to bring that into the into the mainstream, so that understanding could be more widely accessible, broadly accessible, between patients and professionals. Um, Interestingly, there have been only a few a few additional examples where that is actually happening, at least with um, where patients, for example, or even professionals, health professionals, could be uh, um, uh, in, uh, involved in certain uh, uh, um, uh, online or social media groups, but the evidence and the research around the context that might be shared within them, it's still quite restrictive, and does not uh, unfortunately um, that knowledge, the knowledge that is shared within those sorts of groups, uh, unfortunately does not always or there are limitations, at least, where the evidence is around them. For example, again, seeking to address certain areas of health, or healthcare, are not put out or shared through, for example, paper publications, or shared in a way where both patients and professionals can implement aspects of what's been learned and understood into areas of uh, their own practices. And so, where the RPSG is concerned, that's been an example supporting and driving aspects around health, around kidney, around the kidney care space, um, uh, um, in across several areas of healthcare, um, 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 and have been inviting collaborations, actually, since since concept in 2009. So whilst there is some research highlighting time and effort it takes to sort of also organize evidence-based healthcare support groups, um, uh, it is actually uh, uh, looking at the example via the RPSG, that comprehension uh, surrounding success can also be understood, and actually also refreshing. So some of the references I want to now highlight, and that is some of the references here include where listeners can access further understanding, and these are all paper publications by different authors who are known to have done research around this around topics that have been highlighted in this audio or this podcast. So paper by Alan Gao and team in 2014. The paper is titled "What I Tell My Patients About Clinical Research," and that was published in the British Journal of Renal Medicine. There's a paper by Avals Gomez in 2000. It's a little bit of an older paper, but still quite an important one. This was published in 2006, and is titled "Is Renal Replacement Therapy for all possible in developing countries?" And that was published in Ethnicity and Disease. I think the journal is abbreviated as. There's a paper by Fogo as well, who my understanding is quite a well-renowned pediatric nephrologist. This paper was published in 2007 and is on mechanisms of progression of chronic kidney disease, and that was published in Pediatric Nephrology. Then there's a paper by Garcia and Jar in 2014, chronic kidney disease in disadvantaged populations. That was published in Pediatric Nephrology as well. There's also a paper by Hartzler and Pratt in 2011 managing the personal side of health, how patient expertise differs from the experts of clinicians. That was published in the Journal of Medicine or Journal of Medicine Internet Research. There's the paper that I mentioned, two paper publications by Hugh in 2012. The first one was Hugh and Ackerman in 2012, collaborative help in chronic kidney disease management, supporting individualized problems. And then Hugh and colleagues also published this second paper in 2012, brainstorming design for health, helping patients utilize patient-generated information on the web. And I would say that is actually quite a good paper to kind of start off with, for people to get an understanding of how people might use initial understanding to draw out the most sort of critical information that might help immediately in aspects of their healthcare. There's also a publication in 2013 by Hugh and colleague and team, patient moderator interaction in online health communities. That was that work was highlighted in a paper publication, but also in a symposium. And another paper publication by Hu and their team in 2012, tackling dilemmas in supporting the whole person in online patient communities. That was published in in a computer based or focused journal publication, and then uh, Involve, if anyone wants to, any listeners want to check out the Involve website, they can identify the some of the Involve documents or guidances. There's an Involve document that was published in 2012, Strategies for Diversity and Inclusion in Public Involvement, and that was in 2012. There was also where Involve published some guidance on the use of social media, and that was in 2014. Again, I want to highlight the work by Mohammed and colleagues, their colleagues, and his colleagues, and the paper titled "The Renal Patient Support Group, RPSG, Supporting Patients with Chronic Kidney Disease Through Social Media," that was a publication in the Journal of Renal Care, again in 2014. And the final one really is one by Prainsack in 2014, and the paper publication is titled "The Powers of Participatory Medicine," and that was published in PLOS Biology, I believe that is. And patient activation or participation are things that both are aligned with patient-centeredness in aspects of healthcare, but also are not restrictive or constrained to the patient themselves. Participating in areas of medicine and healthcare across different dynamics is where health professionals themselves should also be more aligned with and to, that draws this audio to a close. I thank you for listening and taking the time out to get an overall understanding of research through social media platforms and best practice. This was a Ztorm Lobostics production. Thank you for listening.